Health Chat is sponsored by Buell Regional Health Foundation.
Hi, I wanted to take just a few minutes to meet with you today to talk about a new concern or problems affecting our communities locally, globally, nationally, and that is monkeypox, sometimes also known as MPV. As we have this discussion, I really encourage everyone to approach this condition, as we do with all conditions affecting our communities, with kindness, compassion, and sensitivity. So monkeypox is a virus from a family of viruses called orthopox viruses. And this particular type of virus is spread through contact, not necessarily through airborne particles like other viruses, but rather through contact of body fluids and secretions. Anyone is potentially susceptible to coming down with monkeypox, anyone who comes in close contact with someone who's actively infected. We do know that some individuals, however, are more likely to develop severe illness or complications if they do acquire monkeypox, and those are individuals that are relatively immunocompromised. Monkeypox symptoms usually start with, symptoms that we commonly associate with many different types of viral illnesses: malaise, headache, fatigue, sometimes some swollen lymph nodes. We call that a prodrome phase. Characteristically, monkeypox then evolves into a rash, sometimes 3 to 5 days, 7 days, 10 days after the prodrome. And the rash usually begins as sort of a red macular rash, can later then progress to a characteristic pustular rash, little white bumps that sometimes have a indented center. Obviously, we would encourage you to stay at home. We don't want obviously to spread to anyone else in the community. Wash your hands, try to avoid contact with others who may be at high risk, people that are immunocompromised, and seek guidance from your primary care provider. There are tests that we do perform to confirm a diagnosis of monkeypox. It involves a swab, usually of one of these characteristic skin lesions. It's important that the swab be done by a healthcare provider who's specially trained and is wearing the appropriate protective equipment so that they lessen their risk of coming down with monkeypox. The results of the tests usually come back within a couple of days, and that confirms the diagnosis. So we encourage individuals who aren't feeling well, have some of those prodrome symptoms, whether it's due to influenza or MPV or any other viral infection, is to stay at home until you're feeling better. 2, wash your hands. If you've come in contact with someone, wash your hands and don't touch your eyes, your nose, because that could be a portal of entry for any particular type of virus. There are treatments that are available for individuals who do come down with monkeypox. Those treatments are in very, very short supply and are usually given to individuals who are at greatest risk. And finally, there is a vaccine that's available. Again, that's in very short supply, but we've been able to administer vaccines to high-risk individuals who have been confirmed to be in close contact with someone who tests positive. It's really important to get information from a trustworthy and reliable source. So I would encourage you to obviously speak with your own personal primary care provider. Certainly look at the CDC or the health department website. They have very, very good information about it, and certainly I would encourage you to look for trustworthy sources of information. In summary, monkeypox, or MPV, is a virus. It's not new. It was first discovered back in the 1950s. This particular outbreak is unusual in that human-to-human transmission is being reported. Previous outbreaks of monkeypox were usually limited to transmission among very few individuals who had come in close contact with an animal reservoir of the virus. The important thing to remember is that monkeypox is something that we want to manage, we want to prevent, and we certainly don't want to stigmatize anyone in our community who may be at risk for monkeypox.